what actually causes FAI? Dr. Nicholas Mercer with you, Improved PT. A lot of questions I get from patients who have hip impingement, FAI, or labral tears is, how did I get this? What did I do to make my hips stop working right? What did I do to cause extra bone on my femur or on my acetabulum? And that's a difficult question because usually there's a lot of different factors that go into that. Now, what I want to do today is look at one article that was published in the Journal of Orthopedic Surgery that looks at the etiology of femoral acetabular impingement. So the study is called The Etiology of Femoral Acetabular Impingement, What We Know and What We Don't. So the authors of this article looked at several different studies addressing what causes FAI. So a lot of the research looked at young adults who participated in athletic activities, but also some pediatric patients and even some people post-surgery. So I'm going to kind of break down what this study tells us about the causes of FAI. So the study starts out stating, there's a lot of intrinsic factors as well as extrinsic factors that contribute to the development of FAI. So the first study they reference looked at the prevalence of FAI amongst siblings and the spouses of the participant. And what they found was there was a correlation between the siblings who had FAI. So if one participant had FAI, their sibling was more likely to have it than their spouse. So that kind of tells us there's probably a genetic factor or something that shared in their history that contributed to the FAI. Another study they looked at was men versus women, which one is more likely to have FAI. And it looks like men have a higher risk of developing a cam impingement, which is when you have extra bone on the femoral head, not on the acetabulum. The study also determined that age, body mass index, and ethnicity did not have a relationship with cam deformities. So we can't attribute cam deformities to those factors. So obviously there are some intrinsic factors contributing to the development of FAI. And next they go into some more activity-related effects, so more developmental. Basically, the researchers found that the participants in the study, we'll call them patients, the patients in this study who participated in more at-risk activities, which they include to be basketball, football, or hockey during either childhood or adolescence or both, were more likely to develop FAI later in life. Now, the authors hypothesized that this is probably due to the excessive hip rotation and flexion that is required in these sports. And as we know, the body adapts to what it does consistently. So these sports requiring supraphysiological rotation, flexion, basically hip movement, the body adapts to that. It sometimes just increases the amount of bone that's in the hip to respond to those increased demands. And then later in life, we find we have FAI. Another cause that the authors state is some sequelae or some resulting effects following pediatric conditions. One of which is slipped capital femoral epiphysis, which is basically as a child grows, they have kind of a growth plate in their hip. And so if we have some distortions in that growth plate, it may go unnoticed, it may compensate and cause that abnormal femoral head shape or extra bone on that femur. Another condition in the pediatric population that they looked at was leg calf Perth disease, which is basically osteonecrosis of the femoral head. Now, they didn't necessarily identify pure FAI. However, in that patient population, as they got older, they did find some structures in the hip that were associated with FAI, and they had symptoms that were associated with FAI. But it's not completely understood, the mechanism behind this, and it's not really, the development of LCPD into FAI is not really understood, so it's hard to make a definitive conclusion on whether or not this condition results in pure FAI. The authors also looked at some studies that observed sequelae of a femoral neck fracture, and mostly in younger adults. So if we have a fracture in the femoral neck, we let that heal. When bone heals, it grows more, right? So we'll actually find that after a bone heals, it's bigger. Now, sometimes that goes down and it recovers to the regular shape of the femur, but sometimes we still have that extra bone on the femur that can cause a lot of these symptoms with FAI. So that's one one patient population that they found had increased prevalence of FAI was in those patients who had a femoral neck fracture. And finally, they looked at post-surgical. So patients, most of the studies they looked at were for hip dysplasia, fixing hip dysplasia. It was found that after these surgeries later on in life, these patients were more likely to develop a pincer deformity. So if we have the femur head and we have the acetabulum, a pincer is extra bone on the acetabulum causing that impingement. So post-surgically, after hip dysplasia surgery and usually an osteotomy, more likely to have that pincer deformity. So overall, the authors looked at several different factors, both intrinsic and extrinsic, to see what contributes to the development of FAI. Now, how do we approach a patient who has FAI? Do we need to have surgery to fix it? Maybe, maybe not. Should surgery be the first thing that we do to help a patient with FAI, hip impingement, or labral tears? Probably not, because that's something you can't take back. With physical therapy, with corrective exercise, with proper manual therapy, we can get the hip working as close to normal as possible, or even normal. If then we're still having those issues, that's when we want to look at surgery. But a lot of patients will get better with conservative approach. And that's why I created the Hip Impingement Solution, which you can access at thehipimpigementsolution.com. This program is something I spend a lot of time on. I've taken what I've learned as a doctor of physical therapy, but also as someone who has suffered from hip impingement and labral tears and FAI, and made 15 tests into self-tests that you can do on your own, which will guide you to your deficits and to the exercises and techniques that are most likely to help you. So it's in a way specialized to you. Now, again, you can access that at thehipimpigementsolution.com if you want a complete solution to your hip problems. Now, if you're not quite ready for that, don't worry. You can still go to youimprovept.com. We have a lot of free information on ending hip pain. You can also check out the rest of our YouTube channel, where I have made a hip impingement playlist, which I will link in a card above. Check out those videos. There are no magic bullets, but some of those videos will help you manage the pain that you're currently experiencing. And then when you're ready for that complete solution, check it out at thehipimpigementsolution.com and get ready to improve your pain, improve your movement, and improve your life.